Hello, and welcome to Covidiosyncrasy, and to this first in a series of short videos about the COVID-19 pandemic and the human response to it. The basic conviction underlying covidiosyncrasy is that while the pandemic is real, the panic surrounding it is a far greater threat. So my idea here is to tell a rather different story to the one that's often been heard via the mainstream British media. And in doing that, I want to provide an accessible overview of some of the key issues and in the process correct some common misapprehensions. There's plenty of supporting information on the Covidiosyncrasy website. Who am I? Well, my name is John Daniels. I'm an Anglican priest with a research background in the earth sciences. And before I was ordained, I worked for a while as a software engineer. So I like to think that I retain some basic numeracy. I'm interested in truth in all its dimensions and in how people handle and sometimes fail to handle the truth. And that, in a nutshell, is how I became interested in trying to take the panic out of the pandemic. So this first video looks back at the move to lockdown in the UK and asks the question, did lockdown make any difference? The mainstream story is that absolutely it did. It was essential to stop a Holocaust virtually. But did it really? Well, let's recap the start of the story. Long ago, way back in December 2019, on the very last day of the year, the World Health Organization became aware of the emergence of a new pneumonia-like illness in Wuhan, China. Its origins were associated with a wholesale seafood market in that city, and it looks as if the virus had been circulating among people there since November. Early attempts to alert Chinese authorities by doctors such as Li Wenliang were suppressed, and sadly Dr. Wenliang went on to die from the disease, which became known as COVID-19. Named after the year in which it emerged, COVID-19 arises from the action of a virus called SARS-CoV-2, a novel virus belonging to the coronavirus family. And this family also includes the deadly SARS and MERS viruses, which emerged earlier in the century, as well as four other far more familiar and benign coronavirus mainly responsible for forms of the common cold. The Chinese authorities placed the city of Wuhan into quarantine on the 23rd of January, but by then the virus had long since spread abroad. The first known case of COVID-19 in Europe was reported on the 25th of January in France. However, the early spread of the disease was most obvious in parts of Lombardy in northern Italy. Our TV screens were filled with distressing images of local hospitals being overwhelmed by huge numbers of COVID-19 patients, and medical staff, again, were numbered among those who died. It's since been established that the virus was circulating in Europe before the end of 2019. Samples of wastewater collected in Milan and Turin on the 18th of December have been found to contain traces of SARS-CoV-2. Traces were also detected in a stored respiratory sample taken from a patient in France during December. Here in the UK, the first case was reported on the 31st of January. The British government's action plan, published on the 3rd of March, outlined a four-phase response: contain, delay, research, and mitigate, to minimize the overall impact of the disease on society, public services, and the economy. And that last phrase encapsulated the government's aims at that point. But much was to change over the next 3 weeks. The first COVID-related death in the UK was recorded on the 5th of March. By the 20th of March, the death toll had exceeded 200, and there were widespread demands for more urgent action. On the 23rd of March, the government bowed to pressure, followed the precedent of many other European countries, and implemented lockdown under the banner of stay at home, protect the NHS, save lives. And key to this change of tack was a report published on the 16th of March by Professor Neil Ferguson's epidemiological modelling group at Imperial College London. The model assumed exponential growth in the spread of the disease during its early stages. Its results forecast a total of 510,000 deaths in the UK in the complete absence of government interventions, and as many as 250,000 accompanying the moderate mitigation policy, which was current at that time. What's more, the model suggested that the mitigation policy would result in NHS critical care capacity being overwhelmed 8 times over. In order to preempt this, the report recommended an alternative suppression strategy intended to stop the spread of the disease altogether. And this would involve the closure of schools and universities and the social distancing of the entire population. Such dire warnings were not lost on the government. It changed tack completely. Mitigating the disease, that is, managing its worst impacts, gave way to trying to suppress the spread of the disease as such. Only in that way, according to the Imperial College report, could we avoid scenes from those Italian hospitals being repeated here. Lockdown had an enormous impact on ordinary people's lives. Society and much of the economy ground to a halt as the earlier goal of mitigation was discarded. These were worrying and disorientating times. But surveys showed that lockdown enjoyed remarkable levels of popular support. Such was the anxiety about the loss of life and regard for the health service. But how far did lockdown serve to protect the NHS and to save lives? Well, it's quite an easy matter to show that it made no difference at all. In fact, it may well have had a much more negative impact in terms of greater loss of life during the period in which it was in full swing, as well as down the road. All you need to see this is access to official government data and a bit of simple maths. But first, we need to get our heads around the idea of exponential growth. You'll remember that this was a basic assumption of the Imperial College model, that the disease would spread exponentially during its early stages. If they were right about this, then we were right to be afraid, very afraid. But how exactly does this exponential growth work? Imagine an infected person manages to infect 2 others over the course of 7 days. Each of the people infected goes on to infect 2 others over the course of 7 days. That makes 4. And each of those go on to do the same, and so on, until after 4 weeks, for example, 31 people would have been infected. After 12 weeks, 8,191. After 6 months, over 134 million. And the whole human population, all 7.8 billion of us, would be infected inside 8 months. On a graph, it would look something like this. And it does look scary, doesn't it? And this despite the fact that the proportional rate of growth, or growth factor, times 2 in this example, doesn't change. It remains the same throughout. And plotted on a graph against time, a constant growth factor would look like a horizontal straight line. Now, let's get back to COVID-19 in the UK in the spring of 2020. We don't know what the rate of growth is necessarily, but if the Imperial College model is right, and we're seeing exponential growth, then day on day, week on week, the growth factor should remain constant. In other words, show a straight horizontal line when graphed against time. So what in fact do we see? Well, let's work it out. Here are some numbers taken from an easily accessible government website. They show the deaths of people who tested positive for COVID-19. And these are more reliable indicators than the numbers of infections, since a lot of the people who are infected won't have got particularly ill, won't have gone to see a doctor, and therefore won't have been registered as such. So these deaths show the tip of an iceberg of infections. Now, I've collected the data into weeks at this point because it shows the trend most clearly. In the second column, we have the number of deaths which occurred in a given week. And in the third column, all I've done is simply divide the number of deaths that week by the number of deaths the week before. This gives us the proportional growth factor, which I mentioned a moment ago. Straight away, we can see something rather odd about that. It seems to be getting smaller all the time. 13 down to 8.5, down to 5.4, and so on. And from the week ending the 17th of April onwards, it's actually less than 1, which means that the number of deaths per week is now decreasing rather than increasing. Let's look at the growth factor on a graph to see what it looks like. Well, that's not a bit like a straight horizontal line, is it? Whatever's going on there, it's not exponential growth. But hold on, you might say, what about lockdown? Wasn't that meant to stop the disease spreading? Perhaps it's the effect of lockdown that we're seeing here. Well, to test that suggestion, we need 2 pieces of information. First, the date of lockdown, and second, how long it takes for someone who gets infected to get ill and die. Well, the first question has an easy answer. Lockdown was announced by the Prime Minister on the 23rd of March. But when might we expect the effects of lockdown to show up in the death statistics? Well, luckily, this has been studied by many people looking at the data from China and elsewhere. It typically takes 5 to 6 days for an infected person to start showing symptoms. That's the incubation period. And then a much more variable length of time before they eventually succumb. Anything from 6 to 41 days has been recorded. The best measure to use here is the median rather than the average, since the average is distorted by the very small number of people who remain ill for several weeks before dying. The median value works out to be 13 or 14 days. So if we add on the incubation period, that gives us about 19 days in total between infection and death. Well, by now you can maybe see where all this is going. Lockdown was on the 23rd of March. Now we can reasonably suppose that its effects on new infections was pretty immediate, and not least given the high level of public support. But this wouldn't show in the death toll for about 19 days, do you remember, as we just saw, while the illnesses of those infected pre-lockdown ran their course. So you'd expect the growth factor, the ratio of deaths between weeks, to remain pretty much the same until getting on for around 19 days after the 23rd of March, which happens to be the 10th of April. So I've shown this on this graph via the dashed orange line. As you can see, it's horizontal, showing a constant growth factor until we get on to about the 10th of April, and then it starts to decline fairly sharply. That's purely for illustration. The fact that I've chosen 8 as the ratio is purely arbitrary. Don't read anything into that. However, the data, the actual data shown by the blue line, follows a very different trajectory, doesn't it? It's going down right from the start. So what that means is that the growth factor is decreasing all the time rather than remaining constant, as would be required for exponential growth. And not only is the growth factor declining, it looks a bit like it could be declining at an exponential rate. Notice how it looks rather like a mirror image of the exponential growth curve we saw earlier. Well, to test whether or not it's declining at an exponential rate, we're going to do something you may remember from school days. We're simply going to plot the same data onto a log scale on the y-axis there. So if it is declining exponentially, we should get a nice straight diagonal line. And as you can see, that's pretty much what we do get. Notice that by the time we get to around the 10th of April, the point at which we'd expect any lockdown effects to start being visible, the log of the growth ratio is already very small. And when the ratio becomes 1, that means the growth in deaths has peaked, has hit a plateau, or started to decline. The trend up until the 10th of April is shown by the red line in this graph. And if we simply extrapolate the red line until it hits the x-axis, we find that this corresponds to the week beginning the 17th of April. So it looks like the outbreak, pretty much from the start, was destined to peak at that point. Lockdown had nothing to do with it. And in case you're wondering what the raw data looks like, the daily data, this is it. As you can see, it's predictably noisy, but the trend is identical. That's the best fit straight line going through the log of the growth factor. And as you can see, it intersects the x-axis round about the 14th of April. And if we look at the actual data, we do indeed see that according to the 7-day moving average at least, deaths in the UK associated with COVID-19 peaked on the 14th of April. Now, a lot of people made some huge sacrifices during lockdown in good faith in order to try to protect the NHS and to save lives. However, the data shows pretty conclusively that this achieved nothing. The trajectory of the outbreak was set from very early on, perhaps even before the first recorded death. Lockdown in the UK had no appreciable impact on the outcome. Now, that's a hard thing to say, and perhaps a hard thing to hear, but the facts do speak for themselves. What the facts also show is that some of the assumptions in the Imperial College model were just plain wrong, massively wrong. And there was never any chance that 500,000 people were going to die. Now, where exactly the model went wrong is a topic we'll come back to in another video. But in the next installment, we'll be looking at how some other people have come to similar conclusions about lockdown and about how COVID-19 outbreaks progress in other countries. And in particular, we're going to notice how a Nobel Prize laureate spotted a familiar mathematical function at work.